So today we're going to be taking a few of your vital signs. Is that all right with you?
Yep.
Okay. So what we'll do is we'll start off by taking your pulse. If you could please rotate your arm around like this. So I would first take my first two fingers and place them on her radial artery here and count for 60 seconds. Okay, so I'm actually only going to do this for 30 seconds now. What we would do is, if this was the first time that I was taking her pulse, or if her pulse felt irregular, then I would do it for a full 30 seconds. As it is, her pulse felt pretty regular and was at about 37, which would give her, if we multiply by 2, would give a pulse rate of 74, which is completely within the normal range. So alternately, I could take her pulse at the brachial artery, there, or here at the dorsal pedis, which I would find by finding the gap between her first and second toes and going about part way up and palpating the pulse there. Alternately, if I was unable to palpate her pulses, I could auscultate at her apical pulse at the 5th or 6th intercostal space on the left-hand side of the chest, about at the mid-clavicular line. I think it's always best to take a pulse in sort of the least invasive spot possible. So I wouldn't go for the femoral artery, which is at the sort of juncture of the upper thigh and the inner hip area. Or having her flip over and do the popliteal artery on the back of the leg. And allowing the patient to maintain maximal coverage and privacy is key here. So following that, in order to obtain a respiratory rate, what I would do is first try to avoid having the patient be aware that I'm taking the respiratory rate. Because that can often change the respiratory rate itself. So what I would do is say, Jill, I'm going to take your pulse again, if that's all right with you. And so what I would do would be to place my hand on the radial artery, cross the hand over the chest, and count the rises of her chest as she breathes for 30 seconds if the breathing rate seems normal, and if it was irregular, then I would do it for the full 60 seconds. Okay, doing it for 30 seconds now for the sake of brevity for this video. She would have a heart rate of 14, which is well within normal range as well. I would watch here at the upper part of the chest for rise, and if I needed to palpate her chest in order to feel to count her respirations that way, I would also place my hand across the upper part of the chest here. For infants, it can be difficult to count their respiratory rates by looking at their chest, so we'd often place your hand on the stomach of the infant. Again, we want to go for sort of the least invasive way to do it. So like holding that wrist and just visually counting the rises of the chest is more appropriate and preferable in this case. All right, so in terms of taking the blood pressure, it's important, first of all, to measure and make sure that the blood pressure cuff is of the appropriate size. For adults, there's a couple different ways that you can do that. Well, for anyone really, there's a couple different ways you can do that. First, if the bladder part of the cuff covers about 80% of their upper arm, that can show that you've got an appropriate size. It should also cover about 2/3 of the space between between the shoulder and the elbow in terms of length. Alternately, it could take a paper tape and measure the diameter of her upper arm in order to determine the correct pressure cuff size. Okay, so I'm going to line that midline up over her brachial artery. Wrap this tightly. Oops, I'm sorry, I put that backwards. The artery line's actually right here. Okay. So then I would want to hang the actual meter where it'll be eye level and also around heart level. We want the bottom of the cuff to be about 1 inch above the antecubital space in the elbow. Want to make sure the valve is closed on this so I can begin pumping it up. So for the first step of this, in order to do the palpation step of taking the blood pressure, I would place my fingers here on the brachial artery, palpate that. Okay, and then I want to pump up the pressure cuff until I can no longer feel that pulse. Okay, and that's about 118. And then I'm going to slowly release the pressure. Okay, and I feel her pulse start up again once I release that, and I stopped feeling it again at around 78, which gives us a blood pressure of 118 over 78. So for the second step of this, I would wait 30 seconds before doing the auscultation version of obtaining a blood pressure. So in the meantime, I'll discuss a couple other optional places for obtaining a blood pressure. We could do on her forearm area using the radial artery as a reference. It could be done around the thigh, although I'd have to have her lay perfectly prone for that, and using the popliteal artery as a reference. And it could also be done on the calf using either the dorsalis pedis or the posterior tibial arteries as reference points for that. So I'm going to go ahead and I'm going to pump this up to, close that again, pump that up to the pressure, the systolic pressure that I felt on the first measurement, which is about 118. Oops, I forgot. In order to auscultate, I'm going to have to put on my stethoscope. Sorry about that. So I want to place you can use either the diaphragm or the bell of the stethoscope. I'm going to use the diaphragm today. I want to place that over the brachial artery and ensure that it's not tucked under the cuff of the sphygmomanometer. So I'm going to release that again. Let me pump it up. Okay, so I can hear her pulse. Pump it up to about the 118. I hear that obliterated. And then slowly release the pressure. Okay, and again, I got about the same. This time it was 118 over 77, which is pretty close. So we'll call that even. So in order to sort of preserve dignity again and privacy, we'd want to take that blood pressure in sort of the least invasive spot possible, which is the upper arm. Sort of have to remove the less clothing and less rolling around and adjusting in that spot. So that's where we would choose.